Assalamualaikum.
Waalaikumsalam, Sir.
Yesterday I asked one question. Alpha blocker non-selective effect on norepinephrine and epinephrine. Who can give answer?
Terkeluar ya? Jawab ya?
Chicken wings,
Iya,
wings,
terkeluar.
pepperoni.
Mau keluar jawab ya? Yang cari jawab
Iya,
ya?
terkeluar.
Iya, terkeluar.
Weh,
Kenapa sih cari tuh?
Chicken wings, chicken wings.
Yang Nabi yang I'm your baby, kayak Nabi cuma di
I'm
nggak malu.
your baby girl, I follow you till you love me.
ini kurekam loh.
Kan kenang-kenangan, nanti kalau sudah tua kita pernah muda.
Mai.
Oh, sakitnya di aku. Laptopnya mati, restart. Itu maksudnya
Iya,
gimana?
enggak apa-apa.
Oh, dia lagi nge-restart kah?
Ya, nggak apa Sir, lama-lama Sir. Guys, tapi ngomong bahasa Indonesia sih. Soalnya ini videonya juga diakses Mr. Howard, maksudnya Mr. Howard juga punya linknya. Ini pas dia review.
Nggak apa-apa.
Kok lucu sih anak-anak. Tapi aku nggak paham.
Udah datang, geng.
Oh, dia.
Ada nyamuk.
Mana? Oh iya. Kira.
Assalamualaikum.
Waalaikumsalam Sir.
Laptop charging finished. That's it. Okay, let's discuss this question. Alpha blocker non-selective effect on norepinephrine and epinephrine. Norepinephrine action on alpha receptor, yeah, especially alpha 1. Norepinephrine action on alpha 1 receptor increase blood pressure, causing hypertension, like increase blood pressure. So if we add alpha blocker in this patient, what happened? Norepinephrine increase blood pressure here. So if you block the alpha receptor, so what happened? Blood pressure going little decrease here, because norepinephrine causing vasoconstriction. So when you add phenoxybenzamine and phentolamine, these drugs doing what? They block norepinephrine. They decrease blood pressure. Okay. In case of epinephrine, in case of epinephrine. Epinephrine especially work on beta receptor, prefer beta receptor first, and then go for alpha receptor. First prefer on vessel beta receptor, beta 1 on heart and beta 2 on vessel, and then go for alpha receptor. So if we add alpha blocker, then what happens? It lead to epinephrine reversal. Lead to epinephrine reversal. It's a new terminology here. Epinephrine reversal. What mean epinephrine reversal? Epinephrine increasing blood pressure one by heart rate. Yeah, increasing blood pressure. Now epinephrine causing what? Epinephrine causing hypotension. Very low blood pressure, very low. Here, just in case of norepinephrine, little decrease in blood pressure in the presence of alpha blocker. Clear? But if the patient having epinephrine in body, then you give what? Alpha blocker. You're giving alpha blocker. So the epinephrine causing very low blood pressure, hypotension. Because here you block this receptor. So epinephrine already not go for this alpha one. Yeah, clear? You also block alpha 2. You also block alpha 2. What happens if you block alpha 2? Norepinephrine high. Done? If you block alpha 2, norepinephrine high. This norepinephrine go for beta 2. Epinephrine also working on beta 2. Norepinephrine also go for beta 2 because you block alpha 1. Okay? So now beta 2 doing what? Vasodilation. This vasodilation very strong. Now two things. This norepinephrine also causing vasodilation because alpha blocker, they block alpha completely. Yeah. And beta blocker, here the epinephrine have action on beta receptor also. This norepinephrine increase norepinephrine because of blocking of alpha 2, also working on beta receptor. Clear? The non-selective alpha blocker in the presence of epinephrine, they causing epinephrine reversal. What means reversal? It means now normally if you inject epinephrine to any patient, epinephrine increase heart rate, increase blood pressure. Yeah, blood pressure going high. But here now epinephrine continuously decreasing blood pressure. Clear? Patient now undergo hypotension. Understand? Very low blood pressure. Very low blood pressure in the presence of epinephrine. It's known as epinephrine reversal. Epinephrine reversal. Done. Alpha blocker plus norepinephrine, mild decrease in blood pressure. Okay, alpha blockers plus plus epinephrine mild decrease? No, too much, too much decrease in blood pressure. Patient now in hypotension. Hypotension. Clear? This is known as epinephrine reversal. So in pheochromocytoma patient, if the patient having epinephrine very high in pheochromocytoma, so the patient can undergo very low if we give phenoxybenzamine phentolamine. So that's why this phenoxybenzamine and phentolamine not just for example, not for proper treatment of blood pressure in pheochromocytoma. We only use just before surgery. Just before surgery. It's not for proper treatment, okay? Just before surgery to control blood pressure when surgeon doing performing surgery for pheochromocytoma. We prepare the patient for surgery, clear? For pheochromocytoma, just before surgery we're using phenoxybenzamine and phentolamine. Done? Otherwise, the patient can undergo very low blood pressure if we use non-selective alpha blocker. In case of high epinephrine in body, these two different things. Okay. In case of norepinephrine, mild decrease in blood pressure, mild little decrease. In case of epinephrine plus alpha blocker, which alpha blocker? Non-selective, not selective. Non-selective, also for alpha 1 and also for alpha 2, phenoxybenzamine and phentolamine. Clear? What's the use for tamsulosin? Yesterday we done this drug also. Tamsulosin we use for
BPH.
BPH. Why preferable drug? What's reason? Two action. Also block alpha 1, also block enzyme. Two things. 5 alpha reductase enzyme. 5 alpha reductase enzyme. This enzyme block. So also help to decrease the size of prostate. Okay. That's why it's a preferable drug. Okay, now to move on the next group, beta blocker. Beta blocker, atenolol, propranolol, propranolol, atenolol, propranolol, bisoprolol, bisoprolol, nadolol, metoprolol, metoprolol, pindrolol, timolol, a very big family. Here another navidolol, timolol, navidolol, pindrolol, acid, butanol, acid, butanol, atenolol, propranolol, bisoprolol, nadolol, navidolol, zetrolol. So the things here is the try to focus here. It's a suffix olol, olol. So in all these beta blockers, in all these are name OL, OL. Propranolol, this drug, firstly discovered beta blocker. Okay. Firstly discovered beta blocker, propranolol. It's very, very effective. Many uses propranolol. Propranolol, bisoprolol, nadolol, metoprolol. Okay. These drugs are used for a lot of purposes. Some of them go for beta 1. Also, if go for beta 1, it means they are selective. This is selective. Okay. And some of them non-selective. Non-selective. Non-selective also block beta 1 and beta. Yeah. Non-selective beta 1 and beta 2. The selective one. The selective one is the patient having angina, patient having MI, patient having high blood pressure, hypertension. So the first thing we prefer selective beta 1 because selective beta 1 they decrease heart rate. Understand? Selective beta 1 they decrease heart rate. Non-selective beta 1 because non-selective also block beta 2. Okay? If the patient having the issue, come to patient, the patient having, the all patient, MI patient having diabetes also, and the heart attack patient, yeah, MI patient having asthma, MI patient having COPD, clear? Hypertension, hypertensive patient plus having diabetes, hypertensive patient plus having asthma. Okay, you want to use drug for MI, you want to use drug for hypertension. Yeah? So if you block beta 1, that's good. Understand? But if you also block beta 2, it's not good for diabetes patient. So if the patient, heart attack, any heart patient or hypertensive patient, having diabetes, having asthma or COPD. So which drug you prefer if you want to use beta blocker? In that time, you must prefer selective beta blocker. Because if you use non-selective beta blocker interfere with diabetes, disturb diabetes also. Okay. Non-selective beta blocker interfere with respiratory system also. They also block beta 2. Is not good for respiratory system. Understand? If patient only having hypertension plus nothing, only hypertension, you can go for selective beta blocker. You also can use non-selective, no problem. Patient only having MIR angina. Okay, for example, so You can go for selective and non-selective, no problem. But if patient have diabetes, patient having asthma, patient having COPD, any respiratory disease, or the patient, diabetic patient, understand? You want to treat heart disease using beta blocker. You want to treat hypertension using beta blocker. So must go for selective one. Understand? Go for selective one. Selective for beta one. Understand? Clear, clear? Selective for beta one. Selective for beta one. Very easy to memorize. Selective for beta one. The name A to M. If the name starts from A till M, these are beta 1. If their name starts from N to Z, they can block beta 1 also, beta 2 also. Now you can understand from this group A selective and non-selective. Atenolol A to M. Go for beta 1. If the name starts from N to Z, it block beta 1 also, beta 2 also. Atenolol A. Acetobutylol A. Propanol. Oh, it's not, it's mean it's also for beta 2, yeah? Here we select the selective one. Which one selected? A to M. Bisprolol selected. Atenolol selected. Acetobutylol selected. Clear or not? Acetobutylol selected. Metoprolol selected. Done? If the name starts from A, for example, atenolol, metoprolol, metoprolol, bisprolol, name starts from A till M. Understand? So if start from A, between A or M, then go for B1 only. Understand? How about this propanolol? Selective or non-selective? It comes after M. M, N, O, P, Q, like this. Okay. Start from N to Z. N to Z. So these go for beta 1 and beta 2 also. It's very easy mnemonics to memorize. If the name start from alphabet A to M, they go for beta 1. If the name starts after M, N to Z, then they are not selective. How about timolol? Selective or non-selective? Non-selective. Yeah. Another pindolol. Selective or non-selective?
Non.
Non-selective. Non-selective means also go for beta 1, also go for beta 2.
Beta 2.
Beta 1 and beta 2. Beta 1 and beta 2. Clear? Okay, let me know about this. Acetobutylol. Selective or non-selective?
Selective.
Selective. It will only go for beta 1.
Beta 1.
Nidolol. Selective or non-selective?
Non-selective.
Nebivolol. Nebivolol. Selective or non-selective?
Non-selective.
Clear? Now easily you can understand. Which drug we use? Okay, now let me know. Patient having MI, having diabetes. Which drug you prefer?
Selective.
Selective one, for example, atenolol, acetobutolol, bisoprolol, metoprolol. Clear? So these are only selective. Understand? The patient having asthma, so must again use this. Done? Having MI, having diabetes in combination with asthma, having COPD, so you must use selective one. Clear? Okay. The patient only having like patient hypertensive patient. Like patient have hypertension. So you can use selective also. You can use non-selective also. This still here done. Okay, now we talk about uses. Beta 1 blocker. Agin, alone. Metro, Poro, alone. Bispro, alone. Okay. Beta 1 and beta 2 blockers. Very famous drug. So pain, alone. Timo, alone. Nado, alone. Nebipo, Nebipo, alone. Propranolol, timolol, nadolol, next one, pindolol also. Okay, these are non-selective. So far, beta 1 and beta 2. Clear? The difference between selective, non-selective done. Okay. Okay. Go another thing. We finish alpha blockers. We have another group, also non-selective. This non-selective, they block alpha and beta. Block alpha and beta. Not to mix the name. Labit, allole. Focus here. What the difference here? Allole, allole. Okay. For beta, start from here. ALOL. Okay. Allole. So it's not a beta blocker. Must keep in mind. It's not only beta blocker. It's also alpha blocker. Allole. Okay. So these two are
Sir, we restart the class.
okay.
Okay.
Alpha and beta.